Good day, everyone. My name is Edwin Acevedo, and I'm currently a fourth-year general surgery resident at Temple University Hospital. Today, I would like to talk to you about my research in adipose tissue in a talk entitled Collagen 6 Alpha 3 expression is higher in the superficial epigastric adipose tissue of former smokers than in non-smokers. The authors report no disclosures. So first, what is collagen type 6? Collagen type 6 is a structural component of the extracellular matrix produced by adipocytes and fibroblasts. It is involved in the early stages of wound healing. It is a heterotrimer with an obligatory alpha 1 and alpha 2 subunit, with then an either alpha 3, 4, 5, or 6 subunit. The alpha 3 subunit is the most abundant of the non-alpha 1 or alpha 2 subunits, and it is upregulated in fibrotic tissue throughout the body, including the liver, lung, and adipose tissue. The overexpression of collagen 6 alpha 3 has been linked to inflammatory pathways in various tissues. Interestingly, cigarette smoking is associated with a higher expression of collagen 6 alpha 3 in the pathological process of other tissues, such as the pancreas, colon, and lung. However, this association has not been studied in adipose tissue of former smokers. In this study, we sought to determine collagen 6 alpha 3 gene expressions across various subcutaneous adipose tissue depots. So what did we do? We obtained tissue samples from paniculectomy, conventional abdominoplasty, and fleur-de-lis abdominoplasty performed by a single surgeon. The specimen were collected following removal and processed within 2 hours. These were sampled from separate anatomic locations referred to as depots, such as the epigastric, umbilical, or hypogastric region. And here you can note a fleur-de-lis incision as well as a paniculectomy or abdominoplasty incision. Samples were then collected both deep and superficial to scarpus fascia in each depot and analyzed as separate samples. Next, we extracted RNA from each sample as per manufacturer's protocol and performed PCR assays for relative gene expressions of collagen 6 alpha 3. These were locally normalized to beta-actin as a reference gene and globally normalized to a reference depot. We performed an ANOVA and compared cohorts based on comorbidities using unpaired t-tests to compare average gene expression. Here, we note baseline patient characteristics including age, race, BMI, and comorbid conditions. After gene extraction and statistical analysis, one could note no statistically significant difference among collagen 6 alpha 3 expression among the deep and superficial depots of the periumbilical, hypogastric, and epigastric regions. And you can see our p-value is 0.79. However, after controlling for smokers versus non-smokers, you will note that former smokers have gene expression of collagen 6 alpha 3 nearly twice as high as the reference depot, whereas never smokers have nearly half the expression of collagen 6 alpha 3. Collagen 6 alpha 3 gene expression was also found to be higher in the superficial abdominal depots of former smokers than in never smokers. So what does this mean? Collagen 6 alpha 3 is higher in former smokers than in never smokers. 2 former smokers have had major wound complications requiring operative intervention, while zero never smokers have. These include keloid formation requiring radiation, injection, and operative correction, and a major wound dehiscence requiring operative debridement and local tissue rearrangement. We will continue to follow up to determine the clinical significance of these findings, but collagen 6 alpha 3 may play a previously undescribed role in wound healing, particularly in the fibrosis and inflammation of adipose tissue and its microenvironment. Thank you.